Greetings from Group C. We are presenting on the Child Developmental Center case. So I'm Lim Boon Fang, and together with my friends Wan Cameron, Hidayah Husna, Aaron, Fatin Faseha, we will be talking about our patient. So our patient is Nick Aurora Marisa, 1 year, 10 months old Malay girl, was brought to the CDC by her mother referred from the Klinik Kesihatan Bandar Tun Hussein On for isolated speech delay with other domains up to age. So the history of presenting illness, initially at the age of 1 year, 9 months old, her mother noticed that she could only speak 3 meaningful words, which are nak, milk, and mama, and no improvement since then. She was also unable to make simple sentences. She only babbles and point using her hand, or sometimes pull adults' hands towards the thing that she wanted. She's unable to point to body parts. Otherwise, she turns to her name when called and was able to understand simple commands, which are give me the bowl, let's shower. She enjoys nursery rhymes but no attempt to sing or hum. She's able to play contentedly near her brother, sometimes play with him also. She's also able to show bye-bye when initiated by others. She has good eye contact when talked with. Not noted to have any repetitive movements or behaviors. She's also flexible to changes that involves daily routine. She has no special interest confined to a single object. Patient also has no hyper and hyporesponsive reaction towards any loud sounds. Further history excludes any history of head trauma, fitting, Down syndrome, or failure to thrive. Otherwise, her other domains correspond to the developmental milestones at her age. Screen time of the patient on daily basis is around 2 to 3 hours per day. She usually watches TV and uses a smartphone, but it is still manageable and controllable. There was no significant past medical or past surgical history. Antenatally, mother was diagnosed with gestational diabetes mellitus on diet control. The serial ultrasound scans showed normal fetal development. Patient was born via spontaneous vertex delivery at 38 weeks with a birth weight of 3.2 kg. Patient had vigorous cry after birth. There was no NICU admission required. Patient developed neonatal jaundice at the day 2 of life and was on phototherapy for 3 days, not requiring any exchange transfusion, and discharged with further clinic kesehatan follow-up. The jaundice resolved at day 10 of life. For feeding history-wise, patient was exclusively breastfed until 6 months old, started with complementary feeding at 6 months as well. Currently, she's not a picky eater. She still breastfeeds. Usually, she will have 3 meals per day. Breakfast and lunch and dinner, she will eat rice or mee, which is 1 scoop in a mouth, plus protein, which are chicken or fish, and some vegetables. There are snackings in between, which includes biscuits or breads. Her immunization is up to age according to the immunization schedule. There was no additional vaccines taken. She has no non-food or medication allergy. For family history-wise, both parents are well with no medical illness. She has 1 older brother, which is 4 years old currently. There is no family history of developmental delay or autism or ADHD or any Down syndrome. It was non-consanguineous marriage between the parents. Her father, which is 30 years old, is currently working as an engineer. Her mother, 30 years old, a housewife, and also the primary caretaker of the children. Mother sometimes is busy with a bakery at home, but she claimed to interact with the children as usual at home. Both parents interact with Malay and English language. Time spent with mother is 24 hours, while with father is 12 hours. Both are non-smoker or non-alcoholic. Patient lives with nucleus family in a single-story house at Bandar Tun Hussein On. It is financially stable. So in summary, our patient Nick Aurora, 1 year, 10 months old Malay girl, born uneventful at term, taken care by mother and was referred to CDC for isolated speech delay with able to say 3 meaningful words and understand simple commands. She has good eye contact but not noted to have restricted repetitive behavior, and there's no family history of developmental delay with other domains up to age currently. So upon developmental assessment, her gross motor corresponds to 2 years old, whereby she can walk without support, run avoiding obstacles, throw ball overhead without falling, and able to push tricycle with feet. For her fine motor wise, she also corresponds to 2 years old, which is appropriate for her age, whereby she holds pencil with tripod grabs and scribbles to and fro. She can build tower of 6 cubes and turn pages one at a time. For speech and hearing, it only corresponds to 15 months old, which is delayed, whereby for expressive domain, she is only able to speak 3 meaningful words, which are nak, milk, or mama. She communicates by pointing and vocalizing only. For receptive aspect, she can understand simple one-step command, such as give me the ball. She is also point towards mother. She can also point towards mother when requested, and she can understand bye-bye and no. For social behavior wise, she corresponds to 2 years old, which is also appropriate for her age, whereby she is able to spoon feed without spilling, drinks well from cup, has a good eye contact, and able to put on shoes. She also can help with brushing teeth and dressing. So diagnosis, we have come to a diagnosis of isolated speech delay secondary to inadequate linguistic stimulation. We think that it is because a patient is presented with speech delay at 15 months old. However, there is no autistic feature to suggest it. And other domains also is normal. A point against is that the mother, being the primary caretaker, also a housewife, and also giving full-time care to the patient. So for differential diagnosis, we think that it can be isolated speech delay secondary to autism spectrum disorder. The points against this because patient does not have any obvious features of ASD, such as because patient has good eye contact and patient does not have a confined personal interest towards a single object or activity. And also patient does not have any restricted or repetitive movements, and patient does not have any hyper responsiveness to sensory input. So I'll pass on to my friend.
The next one is investigation that we are going to do to this child. Okay, so the first one, here are the investigations that we are going to do to assess for the isolated speech delay, which is first, schedule of growing skills 2, and the second is modified checklist for autism in toddlers. Schedule of growing skills 2 is a developmental screening procedure based on the well-known developmental sequences by Dr. Mary Sheridan. The main purpose is to provide an accurate method of developmental screening for child health surveillance program. The benefits are rapid, reliable, consistent, and sensitive tests. It can be assessed since birth till 5-year-old, and the recorded form will list 179 items, which are divided into 9 skill areas. The 9 skill areas are passive posture, active posture, locomotor, manipulative, visual, hearing and language, speech and language, interactive social, and self-care social. Here are the picture of the completed recorded form of schedule of growing skills 2. Our patient's all domains are appropriate for her age except for speech and language domain. The next one is modified checklist for autism in toddlers revised with follow-up, or known as MCHEC. Two-stage parent report. It is a two-stage parent report, a screening tool to assess risk for autism spectrum disorder. It is used for toddlers between 16 and 30 months. Our patient score for MCHAT is 0 over 20, which shows that she has a low risk of developing ASD, only indicated to reassess if clinically suspicious of ASD. The revised diagnosis at the current visit for this child is isolated speech delay secondary to inadequate linguistic stimulation. Here, the next one is principle of management. First, we are going to refer the patient for formal hearing assessment by doing brainstem auditory evoke responses or play audiometry to rule out any hearing impairment. Next, we are going to refer the patient for speech and language therapies. And then we need to encourage parents to create more interactive environment with the child. We need to encourage parents to involve the sibling, which is the older brother, in the treatment process. And we can also introduce parents to early intervention programs or known as EIP. Next one is speech and language therapy. Under this therapy, the speech therapist will work with child to improve speech and language skills and teach the parents on home-based interactive therapy. The goal includes improving spoken language, learning nonverbal skills such as signs or gesture in order to improve the communication skills. The skills in speech and language therapy are strengthening the muscle in the mouth, jaw, and neck, and neck, matching clearer speech sounds, matching emotions with the correct facial expression, understanding body language, and matching a picture with its meaning. Here are our responses. Thank you.